The U.S. has approved the first pill designed to treat postpartum depression, offering a lifeline to new mothers. Now, postpartum depression is a condition that some mothers suffer from after giving birth, and it can lead to extreme sadness. It's estimated that 1 in 5 women are affected globally. Until now, treatment for postpartum depression was very limited. There was one intravenous drug, but that cost around $35,000. The new medication is a pill to be taken daily for 2 weeks. Clinical trials demonstrate significant improvement within 3 days, and this pill is expected to be available to patients in the U.S. later this year. Well, Julie F. Kay is a human rights lawyer, author of Controlling Women. You're joining us from Pittsfield, Massachusetts in the U.S. Thank you for being with us, Julie. Is this a breakthrough?
It is a breakthrough in many ways. Postpartum depression is a serious condition, and it's one that has been overlooked for far too long. I wouldn't say it's not a big breakthrough, but the question now is how we allow access to this medication and for whom in this country.
Okay, why?
The United States tends to allocate health care according to many factors, including money, access, race, and we really need to make sure that anything that helps maternal health or provides sexual and reproductive health care is available to everybody, no matter where they live, no matter who they are. And often health care goes to the highest bidder in the United States.
You told our team before the interview that this is what you call a profit pill. Talk to us about that.
Well, I think this is a for-profit solution to a very big problem in the United States, in that we don't have much support for new mothers, for new families, and for people who are giving birth. We're one of the only industrialized countries that doesn't have any federal paid parental leave. We have a really bad childcare shortage here. And as I said, access to health care is limited, including postpartum care, lactation consultation. So this is certainly one good step forward, but it is a sort of for-profit solution. It's a pay what you can, even for those who are getting it through government subsidized Medicaid. It's still only one very small piece of a puzzle of healthy families and healthy maternal care.
So listening to you, really, there are 2 parts to this conversation. I mean, one is the pharmaceutical industry providing a solution and providing help to a problem that exists? And the answer to that, you agree, is yes. This pill is an answer to a problem that does exist, affects 1 in 5 women, which is depression post-birth. And you're saying the other part of this, or rather you're saying, and correct me if I'm wrong here, I'm paraphrasing, is this is not going to help if it doesn't actually get to the patients that need it, and that's public policy.
Right. If it doesn't get to the patients who need it, and it also doesn't address the wider problem of prenatal care, of our horrific rates of maternal mortality in this country, the race disparity around maternal mortality. The rate for Black women is about 4 times as high as it is for white women in parts of this country. And so we really need to start looking more holistically at government support for maternal and reproductive health care. We tend to play politics around abortion, around access to sexual and reproductive health in this country. And, this is one step forward, but I think we can't have this conversation without regarding the higher risk to women in this country around maternal care.
Well, I was going to say, what are the prospects for this becoming widely available, given that, the context in the U.S. right now is actually restricting abortion rights very heavily?
Right. I think, I work in the space a lot around access to abortion, and we're living in a time and place where women's health and people who can get pregnant is very, very dangerous in parts of the country, large parts of the Southeast, where there is no access to abortion care, regardless of the person's circumstances. And we're also looking at people who are deciding that they can't continue a pregnancy because they don't have the financial resources to, take care of a child or an additional child to their family. And so while this is one, moment to celebrate that there's a recognition of maternal health, of postpartum depression, and a pill that could help a lot of people if used properly and prescribed effectively, it's a really small piece of a puzzle that we need to address in this country for everybody's sake.
But that's something I want to drill down on with you. You're the author of Controlling Women. Isn't this medication precisely the kind of medication that could allow women, to take back some measure of control. Women who suffer from depression after giving birth and who are victims of that and who didn't have a whole lot of help.
Absolutely. The fact that we're taking postpartum depression seriously, the fact that we're taking mental health seriously is a huge step forward. But we're talking about sort of a quick fix, hopefully, and we're not looking at, why are women in this country going back to work so quickly after having birth? Why don't they have paid leave? Why is the expectation in this country that if you're lucky, you get a few weeks of unpaid leave? We really need to look at how we can do better in prenatal care, particularly for women of color, in birth options for people, as well as the postpartum period. And the postpartum period is a lot longer than a few weeks and even a few months. It really takes time to establish somebody's family to get the kind of care that they need and to give kids a healthy start in life.
All right, all those points are...
We claim to be a pro-child, pro-life country, and we've got to start acting like it more and more. It can't be a political statement. It needs to be something where the government really helps everybody access their human rights to sexual and reproductive health care and freedom from discrimination.
And Julie F.K., human rights lawyer, thank you so much for joining us on the program today.
Thank you.